Kidney problems on Ozempic or Mounjaro usually do not start because the drug suddenly poisons the kidneys. They usually start when nausea, vomiting, diarrhea, or early fullness quietly cut food and fluids for a few days, then dehydration lowers kidney blood flow. That is why one rough weekend can matter more than the shot itself. The real danger is often fluid loss, not the drug alone. In the hospital, a sudden rise in creatinine, a blood test tied to kidney function, may get linked to the shot. That wording can mislead people. The lab changed while the person was taking the drug. It does not prove the drug directly damaged the kidneys. Kidneys need enough blood flow first. Vomiting, diarrhea, or early fullness can cut food and fluid before any lasting damage appears. When blood flow drops, kidney numbers can worsen fast. That pattern is often the real story behind the panic. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs can help blood sugar and weight over time. They do that by slowing how fast food leaves the stomach and by lowering appetite. That same effect can backfire over a few rough days. If you feel full after a few bites, you may also drink less, add nausea or diarrhea, and kidney blood flow can start falling before you realize there is a problem. That is why long-term benefit and short-term risk can both be true. Over months, these medicines may help the kidneys by improving blood sugar and lowering extra body weight. Over one bad weekend, the same treatment can still contribute to a sudden kidney problem if intake falls apart. The people I worry about most are older adults and anyone who already has kidney disease. I also worry about people with heart failure, meaning the heart does not pump well, or very high blood sugar. Risk climbs further if you take a water pill, a medicine that makes you lose more fluid through urine. Pain pills like ibuprofen or Aleve can add more stress during dehydration. Very high blood sugar adds another risk because extra sugar pulls water out through the urine. So a person with high blood sugar can lose fluid from two directions at once. They may drink less because of the shot and urinate more because of the sugar. If you already have kidney disease, ask your doctor when to recheck kidney blood tests. Ask again after starting the drug or after a dose change. People with a transplant kidney or severe kidney disease should call earlier, not later. Getting advice early is easier than ending up in the emergency room. That is why most emergencies do not come from one dramatic cause. They come from a pileup. A dose increase can land in the same week as a stomach bug, hot weather, or alcohol. Add hard exercise, poor drinking, and one extra pain pill. That is how a manageable situation becomes a dangerous one. Early dehydration often looks ordinary. You may think you are just not hungry. You may blame the weather, the workout, or the stomach bug. Meanwhile, urine can drop, dizziness can grow, and kidney numbers may already be moving the wrong way. Usually, dehydration is the main driver. Less often, the medicine itself may play a more direct role, but that is not the main pattern doctors report. Much more often, fluids and medication review improve the picture after vomiting stops and intake recovers. Some people push through obvious symptoms because the weight loss feels rewarding. They keep the schedule, skip fluids, and tell themselves tomorrow will be better. That is exactly how a manageable situation turns dangerous. The body does not care about momentum. If intake keeps falling, the kidneys can fail before the person admits the situation is serious. The practical warning signs are not mysterious. You are drinking less, urinating less, feeling lightheaded, and getting weaker. Blood pressure may fall when you stand. You may feel drained, foggy, or faint. Sometimes the blood test changes before the person realizes how little food and fluid have been coming in. That same pattern can become more obvious when you stand. If the room spins, your pulse races, or you suddenly feel weak, dehydration may already be building. That does not always mean danger. It does mean you should pay attention and act early. Doctors call a sudden drop in kidney function acute kidney injury, which means kidney function got worse over a short time. The term sounds like permanent damage, but it often does not mean permanent damage. In many cases, kidney function improves after fluids and medication changes. The term describes a fast change in kidney function. It does not automatically mean lasting damage. A lower risk situation looks different. The person feels well, drinks normally, urinates normally, and has stable blood tests. In that setting, the same drug can carry much lower short-term risk. Risk depends on symptoms, hydration, other medicines, and baseline kidney health. For short-term kidney risk, the biggest clues come from the last 2 days. Check whether fluids stayed down. Check whether urine output dropped. Notice whether standing brings dizziness. Those clues tell you more right now than the number on the scale or the label on the box. If symptoms are still mild, act early. Protect intake before the lab gets worse. Take small sips often, use bland food, and pay attention to urine amount, not just thirst. Thirst can lag behind dehydration, especially in older adults. Waiting for a dry mouth can be too late. If vomiting keeps going, or you cannot keep fluids down, contact your medical team. Ask whether the dose, the timing, or other medicines should change. Doctors often review water pills and certain blood pressure medicines after a day or two of poor intake or stomach symptoms. The problem is often the combination of dehydration and several medicines, not one bottle alone. Get urgent care if you are barely urinating, cannot keep liquids down, feel faint, confused, or have belly pain. Go now if shortness of breath appears. Get checked sooner if you have one kidney, a kidney transplant, or need dialysis. In that setting, waiting for the next routine visit is a mistake. Do not try to guess at home which group you are in. Some people improve quickly, but some have a true emergency. After each dose change, watch intake more closely for several days. On travel days, hot days, or sick days, be more deliberate about fluids. If another doctor adds a water pill or tells you to use ibuprofen, tell them that you take Ozempic or Mounjaro. Dose increases deserve special respect. A dose can feel fine 1 month and rough the next. An increase, a stomach bug, or heavy heat can change the picture fast. That is why copying someone else's routine is risky. Your kidneys respond to your week, not to social media. Ozempic and Mounjaro usually are not directly poisoning the kidneys. The bigger risk is dehydration and lower kidney blood flow after nausea, vomiting, diarrhea, or poor intake, cut food and fluids. People who avoid bigger problems usually notice warning signs early and ask whether other medicines should be paused or changed. Watch hydration, urine, and how you feel today, not only the scale. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.